Acute pancreatitis is a very dramatic disease with very sudden, severe upper abdominal pain, and the patient almost always needs to be admitted.
8 signs of pancreatic disease. Did you know that about 66,440 Americans have pancreatic cancer and have no idea? A study by the American Cancer Society in 2024 further shows that about 51,750 people will die of pancreatic cancer. The pancreas is an organ in the abdomen that releases enzymes to aid digestion and produces hormones to help manage blood sugar. So how can you be sure your pancreas is working fine and you are not among those numbers? Watch until the end of this video to learn the 8 signs of pancreatic disease to look out for. Number 8. Back pain. Did you know that sometimes those terrible backaches you complain about may not always be a result of old age? It could be something even more alarming that requires you to take more urgent action. Pain in the back is a common sign of pancreatic cancer. It usually occurs in the abdomen or mid-back, and a tumor causes it. When tumors are formed in the body or tail of the pancreas, they usually get enlarged and then press on the spine and other nearby organs, leading to pain. The tumor can also grow so large that it begins to compress surrounding tissues and nerves around the pancreas, leading to discomforting pain. Usually you may feel this as a dull and persistent pain that keeps gnawing at you. It tends to intensify right after eating or when you wake in the morning. Many conclude that this pain is due to a poor sleeping position and fail to notice this as an early sign of something serious. Sometimes this pain can be relieved by leaning forward, and the severity of the pain can differ from person to person. But other times it can even get worse. Undiagnosed pancreatic cancer can spread through the body and also the bone. It gets worse when it gets to the bone, as it can lead to localized back pain, sometimes causing weakness and fractures. If unchecked, the tumor can spread over time, obstructing the bile duct and leading to a buildup of bile in the bloodstream, which can lead to jaundice. You can see this when the color of the eyes changes to yellow. But that's not even all, and many ignore this next symptom. Number 7. Itchy skin. Itchy skin or pruritus is also another sign that you may need to run to the nearest hospital for an examination, but many ignore this sign too. The buildup of bilirubin in the bloodstream due to the obstruction of the bile duct can also lead to itchy skin. How? Let's break it down. The buildup of bile in the bloodstream also leads to elevated levels of bile salts, which can cause the skin to itch. The inflammation of the pancreas also interrupts the efficient production and release of essential digestive enzymes in the body. When this happens, the absorption rates of fat from one's diet drop drastically, leading to a deficiency of fat-soluble vitamins like vitamins A, D, E, and K. These are essential vitamins, and when they are lacking in the body can cause skin dryness and itching. Also, the high bilirubin in the bloodstream, which causes jaundice, can lead to itching of the skin. Also, pancreatic cancer or pancreatitis can cause metabolic disturbances and changes in biochemistry. These alterations may indirectly lead to itching for some individuals. But it doesn't just end in the skin. Here is something else you should pay attention to. Number 6. Dark urine. We have explained that pancreatic inflammation affects the bile duct and causes the buildup of bilirubin in the bloodstream. Bilirubin is a dark yellow-brown substance made in the liver. It plays an important role in the body's clearance of waste products that arise from the destruction of aged and abnormal red blood cells. The bile duct is the transport system for bile from the liver and gallbladder to the small intestine to aid digestion. But when a tumor affects the bile duct, the flow of bile is affected, leading to a buildup. When this happens, bile can no longer flow freely, and bilirubin accumulates in the bloodstream. Excess bilirubin is not easily removed by the kidney and hence makes the urine dark or tea-colored. However, while not all dark-colored urine is a result of pancreatic disease, this is an important symptom that shouldn't be ignored. Number 5. Enlarged gallbladder. Recall that we mentioned that the bile duct is the channel for transporting bile from the gallbladder to the small intestine. But in the case of pancreatic cancer, where the tumor blocks the bile duct, it leads to another issue. If the cancer blocks the bile duct, bile can build up in the gallbladder as the flow is restricted. Over time, this accumulation causes the gallbladder to enlarge. This is accompanied by severe pain. You should visit a doctor at this point for a physical examination. A doctor can easily feel this inflammation as a large lump under the right side of the rib cage. But it's not just the gallbladder. Pancreatic diseases can also enlarge the liver, especially if the cancer has spread there. During the physical examination, the doctor might be able to feel the edge of the liver below the right rib cage. The enlarged liver can also be seen in imaging tests. In some other cases, pancreatic diseases can cause gallstones to form inside the gallbladder. These gallstones may also become an obstruction to the flow of bile through the bile duct, leading to inflammation of the gallbladder, cholecystitis, and enlargement of the gallbladder. Typically, changes in the bile composition and flow can lead to the enlargement of the gall, which is a sign of pancreatic disease. Number 4. Blood clots. One sign you should look out for to know if you have a pancreatic disease is any sign of a blood clot. Blood clots and fatigue can also happen to people with pancreatic cancer, so it is important you watch and monitor these signs. Pancreatic cancer can easily trigger a hypercoagulable state in the body, which makes it easy for blood to clot. This is due to the presence of the tumor cells, which promote blood clot formation. Usually there is a blood clot in a large vein, usually in the leg. This is referred to as deep vein thrombosis or DVT. There is usually swelling, with redness which is painful. In some cases, a piece of the clot can break off and travel to the lungs, leading to difficulty in breathing and chest pain. A blood clot in the lung is called a pulmonary embolism. Pancreatic cancer can disrupt the body's normal blood clotting mechanism by triggering systemic inflammation and immune system activation. Other times, pancreatic tumors can enlarge and compress nearby blood vessels, causing blood flow to remain stagnant and leading to clot formation. Number 3. Fatty stools. One of the signs of pancreatic disease is that you will have difficulties digesting foods. This makes it difficult to absorb needed nutrients into the body. Bilirubin normally gives stools their brown color, but if the bile duct is blocked, stools may become light-colored or gray. Pancreatic diseases usually lead to the inflammation of the pancreatic tissue and affect the production of the necessary enzymes needed for digestion. Also, when the bile and pancreatic enzymes can't easily get through to the intestines to help break down fats, the fats are excreted in the stool. Usually these stools are foul-smelling, which is characteristic of steatorrhea. They are also greasy and might float in the toilet due to their high fat content. The changes in the stool appearance indicate malabsorption of fats, which is a sign that the pancreas is inflamed. This is not good, as the malabsorption of fat can lead to a deficiency in fat-soluble vitamins and essential fatty acids, which are important for an individual's overall well-being. Due to this deficiency in minerals and vitamins, other signs such as dry skin, poor wound healing, and vision problems may begin to manifest. Knowing the problem is not enough. What food can you eat to reduce this? Eat a variety of vegetables and fruits. These are high-nutrition meals and low in fat. Also eat whole grains such as cereals, breads, crackers, rice, or pasta. Number 2. Depression. With all of the symptoms mentioned so far, the back pain, the itchy skin, the enlarged bladder, one common thread runs through them all: pain. Pain is the most common symptom of pancreatic diseases and the main reason for patients to seek medical attention. Usually, more than 80% of patients with pancreatitis or pancreatic cancer will experience varying degrees of upper abdominal pain during the course of the disease. Pancreatic diseases such as pancreatic cancer and pancreatitis cause chronic pain, and it is very easy for patients who experience this pain daily to fall into depression. A study done in the early 1930s showed the link between pancreatic cancer and depression. In the 1970s, it was found that 14% of patients with pancreatic cancer already had depression present at the time of the diagnosis of the cancer. A recent study also showed that in the United States, the incidence of anxiety and depression among patients with pancreatic diseases was 46.8%. Pancreatic diseases affect the individual's overall well-being, affecting their quality and length of sleep and daily functioning. Individuals with pancreatic diseases experience a wide range of distressing symptoms, which include weight loss, fatigue, changes in appetite, and difficulty in digestion. When these happen for a long time, it can increase feelings of anxiety and depression. The chronic abdominal pain or vein swelling can also limit the extent one can work or engage in any social activity with friends or loved ones. This feeling of isolation increases the feeling of depression. Although the exact cause and mechanism for this have not been established, we could link it to certain causes. For instance, inflammation, oxidative stress, and alterations in the neurotransmitter level associated with pancreatic diseases may cause changes in mood, which may lead to depression. Number 1. Onset of diabetes. Insulin is a very important hormone that regulates the amount of sugar in the blood. The pancreas is responsible for producing this hormone. Insulin helps cells absorb glucose from the bloodstream for energy. However, this is not the case for someone with a pancreatic disease. Patients with pancreatic cancer or chronic pancreatitis usually have damaged pancreatic cells and will not have proper insulin production or secretion. As a result, normal glucose metabolism in the body will not occur, which will in turn lead to abnormalities in blood sugar regulation. This could lead to impaired fasting glucose or impaired glucose tolerance, which are usually precursors to diabetes. Certain types of pancreatic tumors, such as insulinomas or glucagenomas, can directly affect blood sugar levels by overproducing insulin or other hormones involved in glucose regulation. This can lead to hypoglycemia, low blood sugar, or in some cases the development of diabetes. Symptoms can include feeling thirsty and hungry and having to urinate often. Also, pancreatic cancer can lead to small changes in blood sugar levels that don't cause symptoms of diabetes but can still be detected with blood tests. But it's not enough to know the symptoms of pancreatic diseases. What's next? Go for screening. You may not have any of the symptoms, but a screening test will put you on a safer side. The tests might involve imaging tests like MRI and ultrasound. They are usually repeated every year. If you have a family history of pancreatic cancer, then discuss it with a health professional. Genetic testing can find DNA changes that run in families and increase the risk of cancer. Are there ways to lower the risk of getting a pancreatic disease? Yes. You can reduce your chances of infecting your pancreas by quitting smoking, avoiding drinking a lot of alcohol, and maintaining a healthy weight. If you have symptoms that worry you, ensure you make an appointment with a healthcare professional. Please click the like button and subscribe to the channel to get more educational health videos like this one. Thank you for watching, and we will see you in the next video.